All right, thank you for coming. My name is Nicole. I'm here from Spectrum Health Lakeland, Diabetes and Nutrition. And this is an annual event for those who have not attended before. So November is Diabetes Awareness Month. And so this is our way of kind of welcoming people from the community into a little bit about what we do here at Lakeland with regard to diabetes. And so we have on staff tonight, or here tonight, our group of diabetes educators and Dr. Amanda Morris. So Dr. Amanda Morris is upstairs in Spectrum Health Lakeland's endocrinology practice, and she is here tonight to talk to us about complications from diabetes. So I'll turn it over to her.
Hi.
Can you guys hear me without the microphone, or do I need to use the microphone?
Microphone? Oh, okay. So welcome. I'm Amanda Morris. I'm one of the endocrinologists upstairs. Together we have 3 providers for diabetes care. Myself, Dr. Amina Iqbal, who's a new endocrinologist to our practice, and Devalit, who's a nurse practitioner. As I start tonight, I'm going to try to make this more of an interactive discussion because I think I don't know how many of you have diabetes in the room, but I think it's important to be actively involved in your care. And by being interactive with this discussion, I'm hoping it will motivate you to be active in your care. So we're going to start with a little bit of a few statistics. 14% of the US population has diabetes. That's 1 out of every 7 individuals. That beats breast cancer. 1 out of 7. What are some complications related to diabetes? Does anyone have any known complication or any idea of some complications we see with diabetes? Anyone? Yes?
Heart failure.
Heart failure?
Eye problems.
Eye problems?
Leg wounds.
Did you say leg wounds?
Removal.
Ooh, amputations. All right, what about kidney problems? All right. Heart disease is the #1 cause of death in patients with diabetes. 50% of all individuals with diabetes will develop peripheral neuropathy. So what's peripheral neuropathy? Peripheral neuropathy means an altered sensation in your extremities. Some people feel it as intense pain, burning, numbness, tingling in the hands or feet. Other people may not have any symptoms of pain at all, but 20% to 30% will have painful neuropathy. Even with getting diabetes under control, that complication or that symptom, that burning, may not get better. That's why it's important to prevent that complication from happening. How about, someone had mentioned eye problems. Eye problems is also seen in about 40 to 45% of all individuals with diabetes. Again, it's something that it can be treated with laser injections if it's severe enough, but in some cases, the treatments aren't helpful once you lose your vision. So it's, again, important getting those sugars down and under control beforehand. Kidney disease. Does anyone know how your doctor is screening your kidneys, or what a first sign of kidney problems might be with diabetes? Does anyone have a doctor who makes them check their pee once a year? All right. Does anyone know what we're looking for when we do that? Yes, so we're looking for something called microalbumin, which is a protein in the pee. So spillage of microalbumin in the pee is an early sign of damage to the kidneys. If you see that, potentially you could be a candidate for a medication that may help the kidneys tighten up and spill less protein and prevent damage to the kidneys. But all in all, any complication could be prevented by just being motivated and getting those sugars under control. Is anyone here happy they have diabetes? I'm going to assume that some of you have diabetes in the room. Did anyone want to have diabetes? Did anyone wake up one morning saying, gosh, I hope I'm diabetic today? No? Was anyone excited when their doctor told you had diabetes? No? Is there anyone out there who, when they were initially told they were had diabetes, felt that if they ignored it, it might go away? Anyone? Did everyone get on board with starting medications right away? Okay. So a lot of times people who have diabetes, it's a shock. You're being told to take medications, sometimes multiple times a day. Other times you're being started on insulin, which are shots, sometimes 1, 4, 5, 6, 9 times a day. And that's hard for a lot of people. The question becomes, is there anything that exists to uncomplicate diabetes?
Lose weight?
Losing weight? What other things might someone do to exercise? And certainly there are other things as far as newer medications on the market, depending on if you're a type 1 or type 2. There are technologies out there that can make life easier. For example, we have continuous glucose monitors, so people don't have to poke their fingers as much. We have insulin pump technologies, which are different methods or a different way of administering insulin to prevent having to poke so many times for shots. And we have certain other medications for individuals with type 2 diabetes that may lessen the need of having to take medications so frequently. So, for example, we have some once-a-week medications that are a potential option if you have type 2, depending on your situation, that may help. This is a little side note for type 2s, there are newer medications out there. The FDA has required that new medications for type 2 diabetes have to undergo studies looking at cardiovascular outcomes. And there are medications out there that are shown to be beneficial in reducing risk for heart attack, which again is the #1 killer of people with diabetes, as well as coronary event equivalents like stroke or heart failure. So is it easy to always eat the right thing? Is it easy to lose weight? No. So doing the right thing is hard. If doing the right thing was easy, everyone would do the right thing. My encouragement is do not get frustrated with yourself if one day you do something wrong. If you go out and you enjoy a meal with your family and you look and your sugar's 300, 1, fix it, but 2, don't beat yourself up over it. The more negative you feel about yourself with your diabetes, the less you're gonna want to take care of yourself. So the biggest thing is just I don't wanna say it's a mistake because you're a person, you need to enjoy life, but if you enjoy life maybe a little bit too much one day and your sugar's out there, just say, okay, tomorrow I'm gonna try better. And each day, just aim to do something a little bit better, a little bit different. We're not perfect. I would love to stand up here and tell you that I eat healthy all the time. I don't. But our stride is to make one extra step. So if it's, okay, today I went out and took a walk, great. If it's tomorrow you ate 1 less cookie, great. Just take small strides forward. I don't have anything else. So again, the goal is to inspire you to not get frustrated with diabetes and just know that you can simplify things and make diabetes, how do I word this? Don't let diabetes run your life and make your life complicated. Get control over it now so you don't have to have all these complications. It's much easier to get into control and prevent having to go on dialysis, to prevent losing your vision, to prevent having your leg cut off, than it is to go retroactive. Because once you have complications, you can't go back. And that's the inspiration, is just don't give up on yourself. Don't feel bad if kind of feel bad, but don't beat yourself up if your A1C is not to goal. Just take that as an opportunity to improve. I think it's very easy to get frustrated when you see you're doing everything that you can and things are changing. Just take a moment. There are many people out there who can help you. Your primary care doctor, you're welcome to come see our office. We have diabetic education who's available to sit down with you, to go through, kind of hone in on what are your meals consisting of? Is there something from diet, exercise that you can do, potential medication changes, to really tailor your medications, your treatment of your diabetes to you. Yes, you still have to do your part. Blood sugar checking or monitoring is the best help to any provider who's taking care of you. This allows us to see where the problem areas may be. For some people, it's dinner time or snacking at bedtime, or they're having lows or highs overnight. But by being able to check sugars, it allows your provider to be able to help you get the best control of your diabetes that is possible. There are a lot of people out here who want to help you. And again, with 1 out of every 7 people having diabetes, you're not alone. So don't feel that you're the only one in the world with diabetes, because you're not. There are so many people here that are there to support you. And we all want to see you do well. All right.
All right, so
Oh, I'm very early.
they'll get to tackle you later with questions. So, all right. So Dr. Morse is going to stick around. We're going to do a quick little food demo, and I believe the kitchen is going to start passing out some plates. So is there any food allergies? Ooh,
Is that me?
Any food allergies? No? Wonderful. Okay. Now I can't hear myself. Are we too close? I don't know.
I don't know how this works.
So, yeah, talk about the recipe.
Can you hear me okay? All right. So part of what Dr. Morris described is, we all want to enjoy life. So hopefully this part of it will show that you can still enjoy life while eating healthfully. Nutrition is so valuable for either preventing or mitigating the effects of diabetes and other conditions. So the recipe that I'm going to demonstrate, do all of you have the recipe card? Is the pomegranate pear salad. Beautifully colorful for the holidays. Pomegranate, the red, spinach, the green. And the first thing I'm going to do is it has a maple cider vinaigrette dressing. I'm going to show you that first. I'm going to use a mason jar. The recipe calls for whisking it, which you could also do, but this is easier. So it calls for olive oil. I would also like you to participate as much as you would like. Any idea why we might want to use olive oil? Nutritionally. It's a healthy fat, exactly. Are you still hearing me okay? Okay, yeah. Olive oil is a monounsaturated fat, which helps to keep our blood fats at a good level. It helps to promote the HDL, have you heard of that? To go up, and the LDL to go down. Of course, we want to, have a moderate amount of total fat because it's high in calories, but within that to choose more of the monounsaturates, which olive oil is. So I'm going to put that in the jar. And then the next ingredient is the apple cider vinegar, which provides the acid. What are some other acids that you've maybe used in dressings? Anybody?
Lemon juice.
I've used lemon juice. That's also nice. That would go good with the spinach as well. Next is some maple syrup. Gives a natural sweetness. And I was reading an article that, you know, we've all thought a sugar is a sugar, and I'm putting 2 tablespoons in here. However, maple syrup has a little bit of calcium, a little bit of iron, and some phytochemicals. Because where does this come from? Anybody? It comes from a tree. So, you know, naturally it would have some of these good beneficial substances. Also, we're going to put some, how do you say? Dijon mustard in here. I don't use it that often, but it gives good flavor. And 2 teaspoons. Oh, interesting.
Too big. I'll squeeze it in.
Okay.
There we go. And then I'm going to start chopping some vegetables here to go in the salad.
All right. The mustard, some salt. Now, I see you're making a bad face about salt.
No salt.
No salt.
No salt.
Optional to add.
Bad for you.
It is optional. It, of course, helps with the flavor, doesn't it? And, you know, most of the salt that we get actually comes from either restaurant food or convenience food products. So if you're not eating a lot of restaurant food, you prepare most of your food at home, it is easier to stay within the recommended 2,300 milligrams a day. Okay, got the salt, and then there's some pepper. All right. So, shake it up. Make sure I got the lid on tight. And there we have a nice yellowish colored dressing, which will complement, you know, the different colors. So now for the salad, we've got spinach, 10-ounce box, 5-ounce box. Recipe says 10 ounces.
Oh, the recipe does say.
The recipe says 10 ounces. This is 5 ounces.
I messed that up. That's my fault. We can just do a half salad.
Oh, what is doing that? Anybody help with that?
Turn off the other microphone.
All right, so I'm going to half everything.
It is off.
So Nicole's chopping up a pear. We'll put that in. And then there's a cup of, I'm going to use a half a cup of pecan. These are rich in antioxidants, also have healthy fats. Some feta cheese. I heard that there was a question about prebiotics and probiotics. Anybody here ask that question? No? I just want to mention the probiotic would be the bacteria, the healthy bacteria that live in our intestine, and feta cheese has some of that. And then the prebiotics would be the fibrous material that the bacteria need in order to stay alive. So we need both. We need the healthy bacteria and we need the healthy fiber in our diet in order to feed those healthy bacteria and keep them alive. So in this salad, we have some of the probiotic in the feta cheese, and we have lots of fiber from the spinach and the nuts and the pomegranate, which is here. And I'm just going to use half of it because we're halving this recipe. How do you like the color in this? I know you can't see it that great, but isn't that beautiful? Okay, so then, and these little pomegranate arrows, you can buy them already taken from the pomegranate. Are you all familiar with pomegranate? Have you tried it? So an easy way to do this is I quarter it usually, and then I'll just kind of pull it back, and then you can get those off easily. And those are full too. The colors are indicators that there are antioxidants present. Like all those colors are functional. So the reds, the greens, they are health protective. So the onion and the let's see. How do we get it in there?
I already used my hands.
Okay. All right, so that's it. Now I'm going to put the dressing on. Shake it up a little more. Yes. How do you like it?
Pretty good.
I think it's a nice combination of flavors. You know, you've got the tart from the mustard, the sweet from the pomegranate, the little sharpness from the feta. Beautiful?
All right, very good.
Oh, and I wanted to say there's 3.3 grams of fiber per serving, and you need about 25 to 30 in a day. So most Americans are kind of short because we don't eat enough fruits and vegetables. All right.
Awesome. And so after our lovely salad, you also have some pie on your plate. And this pie is one that we make every year because it's, in my opinion, and others, that good. And so you'll notice it's missing the crust. That is by design. We pick up a lot of carbohydrates and fats, saturated fats specifically, often trans fat as well, when we buy prepared baked goods such as pies. And so we can maintain that wonderful kind of seasonal flavor in the pumpkin pie, and hopefully you don't miss the crust too bad. So if you look at the nutrition information, that may be of interest to you. So an eighth of a slice, which is more than what is served on your plate, is only 111 calories. So that is a huge, huge savings as far as pie is concerned. And for our carbohydrates, it's 19.5 grams per slice. So that's about 40 to 50% less than maybe 60% less than a traditional slice of pie. So there's some variation there. So I want to show you how quickly this comes together. And so it is literally one bowl, and we are going to start, you also have this recipe, we're going to start with a can of pumpkin, and this is not pumpkin pie filling, but just pumpkin puree, 100% pumpkin, which is extremely high in fiber. Very, very good. So just easy peasy, no measuring, just the whole can, which of course my spatula is too big for it.
Where's that? Oh. You can get your spatula.
I'll use a measuring
Okay.
spoon. Well, maybe I won't use a measuring spoon. Maybe somebody from the kitchen can help.
Okay,
Grab a spoon.
I'll get you one.
Thank you. And then we'll come back to the pumpkin. 12-ounce can of low-fat evaporated milk. So no measuring, pour it right in. And then with the eggs, we do 2 whole eggs and then 2 egg whites. And so you can just crack in 2 eggs. And then everybody has their own way of getting egg whites, but I kind of just go back and forth in the peel. There's my 2. So I just kind of go back and forth to just separate out my yolk here. This is the part my kids always want to do. And I say no thank you. All right. Back and forth. So got egg whites. And then the rest is really just spices and a little bit of sugar. So common myth, diabetics cannot have sugar. That's not the case. Baked goods especially do a little funny sometimes with sugar substitutes, and so a little bit of sugar goes a long way. So thank you very much. So a cup of sugar ends up being 1 tablespoon, or I'm sorry, half a cup of sugar ends up being 1 tablespoon per serving of pie. That's a big savings compared to a traditional pie. So yes, there is sugar, but it is a controlled amount. So I'm just adding everything in here. Go. And then Yes.
Why do you use the pumpkin puree instead of the pumpkin pie mix?
Pumpkin pie mix is going to have added sugar. Yeah, bummer, I know. Yes. So the pumpkin is just pureed pumpkin. You can also make your own homemade, or if you have leftover butternut squash or anything like that, you could definitely use that as well. So half a cup of sugar that goes in, and then the rest is spices. So if I remember correctly, it's a teaspoon of cinnamon and a quarter teaspoon of everything else. So we've got allspice. I don't have a quarter, I'm doing half of a half. Quarter, allspice. Oh, I do have a quarter, thank you. Quarter of ginger, quarter of nutmeg. Did I miss one? No, that's it. And then 1/8 of a teaspoon of salt. Can I pass some salt? Thank you. So just a smidge here, half of a quarter. And then you just whisk it all together and pour it into a prepared pie dish. And so it does take a while to bake. It takes about an hour. And if it seems a little jiggly still in the middle, just continue to cook it another 5-10 minutes. So just gonna whisk it together. Do you mind spraying my pie pan for me? Any questions on this? How does it taste? Pretty good? Don't miss the crust too much? Not at all? Good, glad to hear it. So, think you would consider making either of these recipes at your upcoming holiday gatherings? Wonderful. What about the carrots? Good. So if you, on your recipe card, you can see that those are probably the easiest recipe. You've got carrots, olive oil, salt, pepper, and just fresh dill. So very, very simple, but roasting carrots really brings out a nice flavor in them. So wonderful. Which is your favorite recipe that you tried? The carrots? Yeah? Wonderful. All right, I'm gonna pour this in here. We can bake it off. Like the pie? Good. All right. Here we go. Wonderful.
These are good sources of fiber.
I think your mic might, yeah. So, any questions before we bring our experts up here for our Q&A?
No, there is.
No? Oh,
There's no sugar in that.
there
Yes,
is.
there is.
Yes.
Mhm.
I just saw her dump it.
Half a cup in the whole pie.
So,
I watched.
Yeah?
But your serving wouldn't have a lot in it.
it didn't taste.
Did you? No? Was it a little sweet?
It was sweet enough,
Sweet enough.
but it wasn't overly.
Not overly sweet. Good. Glad you liked it. Yeah. Wonderful. All right. Let's bring Susan and Jessica up along with Dr. Morris. I'm sure they're coming. All right. So Claudia was walking around collecting questions. Oh, she took it. Okay. I don't know if Jessica wants to address that one too. And so if you think of a burning question, just raise your hand and we'll be glad to come by with a microphone and you can ask that question. So do you still have your mic?
Oh, no, I didn't.
All right. So Dr. Morris.
Okay, so I will also entertain any other questions that people have from the audience, but I'm going to start with the lovely cards. Question 1, would you ever prescribe one of the weekly injections for a newly diagnosed diabetic before an oral medication like metformin? So I'm going to say that this is for a type 2 individual. Use of the once weekly GLP-1 hormones like Trulicity, Ozempic, Bydureon are technically not indicated in type 1 diabetes and should be prescribed only by someone talking to you about off-label use. So yes, do I prescribe medications like GLP-1s instead of metformin? Yes. The technical indication from the FDA is that these medications are as an adjunct, meaning following use of metformin or in combination with metformin. Most insurance companies may deny then the coverage for the once-a-week medications and say that the patient has to have tried and failed metformin before they cover it. But yes, I will prescribe it for individuals. The reasoning behind that is GLP-1 hormone is a gut hormone that makes our own insulin work better. Again, this is for type 2s. When an individual goes on this, it kind of has the same effect that bariatric surgery which is a weight loss surgery, would have on individuals. So we do see some pronounced weight loss with these medications, and for most of us with type 2 diabetes, when we lose weight, we require less medication and our sugars come down. So yes, the answer is yes for me, but technically it's not how the FDA indicates for it to be used. Question 2, I get dizzy spells after heart and diabetic meds. What do I do? This individual takes Lantus in the morning, and then Metformin at noon and 6 p.m., Losartan in the morning, and amlodipine in the evening. My recommendation, if you're feeling dizzy, please check your blood pressure during that time, as well as your blood sugar, to make sure that you're not having a low blood pressure or a low blood sugar. Low blood sugar would be something less than 70 in my books, but certainly if you dropped rapidly, that could also give you the feelings of dizzy. And low blood pressure, I would say if it's less than 100 for the top number, that could be a sign of a low blood pressure. If after you exclude a low blood pressure and a low blood sugar, if those are not the issues, I would talk to your primary care just to make sure that nothing else is going on. Next, oh, do I alternate with you? Okay. Next question, does it matter what kind of doctor I am seeing to best treat my diabetes, such as an internist, endocrinologist, or general practitioner? You just want to make sure whoever you're seeing is, I don't want to say, they like diabetes, they like to treat diabetes. If you don't feel that you're getting to goal, you're optimizing doing your part, and you still kind of feel that you struggle, then you may want to seek out a specialist. You don't necessarily need to come to an endocrinologist for your second step. You can always start with diabetes education, get a little bit more fine-tuned on some lifestyle modifications, but each doctor is different with what they like to do. So at least for general internal medicine, sorry, I'm on call. We're gonna ignore it for right now. It'll go to voicemail. So each person has a different kind of field that they like within their field. Some general practitioners are very comfortable with diabetes. Others may shy away from it a little bit. So it's very physician specific. But if you do feel that your caretaker is not helping you reach your diabetes goals, then you may want to ask for a referral to see someone else, whether it's diabetes education or the next step to the endocrinologist as well. Besides water, what beverages have the least effect on blood glucose levels? Ooh, water, water, and more water. Oh, you're gonna hate me for this. I hate artificial sweeteners. I'm not gonna lie to you. I hate artificial sweeteners. But if you do have diabetes, fine if you drink diet pop or the sugar alternative sweeteners. I would say water, milk should also have, depending on how much milk you drink, should be fairly okay for blood sugars. So water, milk, black coffee, unsweetened tea, those are some options you have besides water. If you can, the best, I really have a general dislike of diet beverages, but if you could stay away from the artificial sweeteners, it's artificial, keyword artificial, meaning probably shouldn't eat it, but those will also have the least impact on blood sugars. Regular pop, you should avoid that like the plague. Just don't do it. If you're having a treat, fine, I'll let you have some, but just don't do it. It'll raise those sugars so high, and there's no nutrition in it anyways. So water, milk, unsweetened tea, and unsweetened coffee. Okay. Juice, so juices are rich in sugars and carbohydrates, so they're gonna raise your sugar.
It's your juice from apple juice.
Apple juice, ciders, cherry juice, prune juice, all those, all.
Would that be better than regular pop?
In comparison, juice compared to regular pop, juice is a better choice than regular pop because at least there's some nutritional value in it. If you would like to water down your juice, I'll let you have that, but it's really, I'd rather have you eat the orange than to drink the orange juice because you're getting the fiber, and the juice is really just concentrated and tends for a lot of people to raise their sugars. But compared to pop, I pick juice. So my list is water, 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 coffee, unsweetened tea, milk, juice, pop, and then more water.
Or is it alcohol?
Oh, we'll talk later. Just be careful with alcohol. Alcohol affects everyone different. Beers, beers are so difficult. Because beers come in different, dark, light. Michelob Ultra tends to be the best beer, which I have no idea because I don't drink beer. I think it's gross, but Michelob Ultra tends to be the most flat with sugars without dropping. If you're drinking something with straight alcohol, like vodka and your water, because I told you to drink water, just be cautious. The straight alcohol may drop you pretty fast, or may alter your sensation of feeling low. So anything, meaning you may be intoxicated and can't tell the difference if you're drunk or low. So perfect. So anything with alcohol is in moderation, and if you are going to have a drink, I would just make sure you're not going out and doing it at a party first. Just kind of experiment with it at home first, so that way you know how it affects you. That's a little bit more for my type 1s, because again, beer sometimes actually raises sugar. If you're having another drink, it can lower sugar, so it's kind of all trial and error, but no one in here looks like they're going out for their 21st birthday this coming weekend, so we don't have to have that fun conversation. You are?
Yeah, this coming weekend.
This coming weekend? You let me know, I'll go out with you and supervise. All right, exercise for overweight senior if diabetes. Best place to start, walking. Unless you are limited with some knee injuries, I would start with walking. If you have some knee injuries, I would get into the pool and maybe do some aquatics. The Y actually is quite nice. I go to the Y. You don't need to be fancy. Anytime Fitness is cheap. Planet Fitness is cheap. I motivate to go to the Y because I pay for it, so therefore I feel that I must go because I'm paying into it. If you're someone who likes to pay money and not go to the gym, then that's not a good option for you. But I would start with walking. If you have some arthritis or limitations with walking, then I would start with some pool classes. I like group classes, especially, or doing something with a buddy, because then you're held accountable. It's easier to be like, well, I don't want to go to the gym today because I just don't feel like it. But if you know that someone is waiting for you and planning to meet you there, then you feel obligated to roll out of bed and go. So I tend to like group classes, especially if you're starting to get into exercise, because then you're kind of held accountable. Weather here right now is probably not the best opportunity to go walking outside. So walking and swimming. If you want to join me for the turkey trot in Benton Harbor on Thanksgiving, that would be awesome. I'll be the one pushing a stroller. Would you ever, I answered all mine. Okay, does anyone have any other questions for me? Yes?
What is a preferred hemoglobin A1C?
Ooh, okay, that's a good question. So what is the preferred hemoglobin A1C? So we'll back up. What is hemoglobin A1C?
3 months.
All right, so the hemoglobin A1C is a reflection of your blood sugars over the past 3 months. And basically, you have hemoglobin, which is your little red blood cell, right? and sugar sticks to it like lollipops. So we count how many lollipops are on your red blood cell to determine how high your sugars must have been on average to get those lollipops. That's not exactly it, but close enough. So, per my society guidelines, so the American Association of Clinical Endocrinology, A1C goal is less than 6.5. The reason behind that is the large study looking at individuals with with diabetes shows decreased risk of microvascular complications. That's going to be the peripheral neuropathy, numbness, tingling, burning in the legs. That's going to be retinopathy, which is the damage to the eyes from diabetes, and that's going to be kidney problems with A1Cs less than 6.5%. Your A1C goal should be tailored to you. The longer duration you've had diabetes and the more mature you are, you probably don't need to be that strict with your A1C. Lows are more harmful lows are harmful in general, but particularly as we mature because they can cause funny heart rhythms and sudden death. So it really should be tailored. Ideally, I would love everyone to be under 6.5. If we can't get you under 6.5, my recommendation is under 7. If I can't get you under 7, it's 7.5. If I can't get you under 7.5, we do 8. Everyone should be under 8. The new guidelines for general internal medicine, I do not agree with, saying that everyone should be under 8 and that's okay. That's not okay, because that's going to give us increased risks of microvascular complications. We know that. I think that was a big push because diabetes is expensive. Everyone knows that in this room. Diabetes has not gotten cheaper to manage. It's only gotten more expensive. I think that was a big push to lower cost, healthcare cost, but an A1C less than 8, we know people do develop complications. And in the end, dialysis is much more expensive than getting it treated in the go. So ideally 6.5 to less than 7, but really should be tailored to you as an individual. Did that answer it without me going too on tangents? All right, any other questions for me? Okay, well, I hope I inspired you guys just to know that you're not alone. A lot of people have diabetes. Do not be ashamed to check your sugars if you're out and about. Do not be embarrassed to take a shot of insulin. Everyone has seen a tummy before. It's okay if you need to lift your shirt to take a shot. That's not how people take drugs, so no one's going to think that you're a drug addict if you're taking shots at the restaurant. It's better to be a healthy you than to worry, number one, what other people think. Who cares? And two, it's your life. You are in control. None of us are going to go home with you every day and give you your shots. It's got to come from within you. So just making a small step each day and just saying, if you slip up, I can do this again tomorrow, that's the most important thing to do. All right. Ooh. Thank you. Thank you. I'm going to go back upstairs.
Thank you.
Working? Okay. All right. Last and final question for our question and answer panel. This is a nutrition-related question. So the question is, probiotics versus prebiotics, is one better than the other to take to maintain a healthy, balanced stomach? So let me back up and explain the difference between probiotic and prebiotics. Probiotics are live, active gut bacteria, and it's a healthy bacteria that we want to have in our gut. And it's naturally occurring. Prebiotic is what the probiotic lives on. So it's the food that the probiotic is feeding on to survive and thrive. Prebiotics are going to be found in fruits and vegetables. We consume them. So Monique was explaining that in our salad, we have naturally occurring prebiotics, in the spinach, the onion, the pomegranate, and the pear. And the probiotic is going to be the feta cheese. So probiotics will be found in things like cheese, yogurt, kefir, kombucha. And so you can actually do a probiotic in a supplement form, and that is another option to get that probiotic. But we need the probiotic as well as the probiotic to make the probiotic work effectively. So that would be from our diet mostly. So does that answer the question? Yeah? Okay. Any other questions? Yes.
Do other things like brown rice or quinoa, any of those count as prebiotic, or does it have to be natural spinach?
Yeah, it can. So fiber is going to help in terms of the prebiotics. So foods that contain fiber, the brown rice, quinoa, like you mentioned, that will help as well. Any kind of, like if we think of a plant-based diet, 75% of our diet coming from plant-based sources will really help probiotics thrive.